one. Thank you. Thank you for coming to Autism Fridays Discussion Corner video again. This time we have Jennifer Mcpherson-Liu, who is a friend, compadre of mine, and we have worked together extensively. So for our first question, please tell the audience your name, your role in the autism community, and either any other credentials you would like us to know, or just anything you would like us to know in general.
Let's see. I am Jennifer Mcpherson-Liu. Hey, guys, turn that off for a minute. Sorry.
That's fine.
Anyway, yeah, that's part of being a parent, I guess. So I am actually a parent of 2 autistic kids, also. I work in the community, and I've worked with kids of all abilities, and like I said, I've got 2 of my own with some different abilities. So, yeah.
Excellent. For our next question, when did you first begin to suspect your child, or children in this case, could possibly fit the diagnostic criteria for autism spectrum disorder, or ASD? And after you began suspecting it, how long did it take you to confirm the diagnosis?
Well, I remember for Devin, Devin is my oldest, and he is 15, will be 16 in October. Woo. And he, yeah, crazy, huh? And so he was actually diagnosed autistic about 3 or 4. He was in pre-K, and they had some concerns. And they went ahead and did the testing and everything, and found that he met all those standards, and or met all of, their qualifications at the time for what, autism was.
And what year? Oh, sorry.
Yeah.
What year?
It was probably about 2000. Let's see, if it was 3 or 4, then that would have been 12 years ago.
Oh, wow.
2006, maybe.
Oh, right. So you had a lot of most of the modern criteria already for like DSM-4 or something like that around the time he was diagnosed. And you mentioned you had a second child. Were the circumstances similar, or?
Jade is my daughter, my only daughter, and she has not only does she have autism, she's also border epileptic, stable on medication, doing quite well there on Keppra. But she was doing really good. I had with Devin, I had a hard time delivering him, and so I had preeclampsia, everything else. When I had Jade, I just had a little bit of high blood pressure and hypertension. I think that's high blood pressure back then. So I found out that she had some problems. She was 11 months old when she had her first seizure.
Ooh.
She would have one every 3 months, kind of like clockwork. It's like I knew when it was going to happen, and I was dreading it every time. Finally got her stable on medication, but not before she had about a 45-minute seizure. After that, she was actually tested along with Devin, and they found that she did not meet the criterias at the time. But then she after she had the 45-minute seizure, basically, it just kind of presented itself, and in the form of mild to severe. Yeah. So then
Well,
she,
go ahead.
yeah, sorry. So she was about 3 also when she got diagnosed with autism. Long story short.
Well, on the bright side, it's been pretty consistent. 3 seems like the magic number.
Yeah.
Well,
Yeah.
moving on, what has been a highlight of raising children on the autism spectrum, and what would you define as perhaps the greatest struggle?
A highlight of raising autistic children, I think, is learning from them by far. I think learning what they can do, their abilities. I just think that it's so amazing what Jade's been able to do. And she's a cheerleader, her 2nd year. She made a flyer, and I don't know the um, the name so much like she does, but she flyer, so they like throw her up in the air, I think.
Oh,
Um,
yeah,
yeah.
yeah. So she got to be
And
part of a major maneuver.
yeah, she's also doing some neurofeedback. So this thing that we got going on right now, but yeah.
Well, that is terrific news.
Hmm.
Neurofeedback has done amazing things for a variety of people, not just those on the autism spectrum. And
Right.
as someone who, yeah, knows these children, I look forward to the results. Um,
Yeah.
so
Awesome.
moving on, what do you think has helped your children with their progress in socializing with others? And in your opinion, what's maybe something that has also held them back?
Um, okay, say that again one more time, Christopher.
So the question is, what do you think has helped your children with their progress in socializing or integrating with others? And in your opinion, what's been like something that has held them back from further progress?
Um, I think that Devin, my oldest, I think that he is held back by, I really, that's a hard one. It's a hard one to answer, I feel like. I could say what I see, but you almost need to ask them personally, because it's such a specific answer, I think, to them.
So in other words, the best avenue would probably be just to, um, at some point when they're comfortable with the setting, maybe just ask them what they
Yeah,
felt has held them back.
yeah, totally.
So in that case, for the first part of the question, then, what have you noticed has worked with them when they've been successful in, say, making friends or doing what, for example, you mentioned your daughter doing, being in cheer?
Yeah. Can you word that again real quick? I'm not
Sorry.
really sure.
So when you've watched them
Right,
interact with
right.
other people and you've
Yeah.
watched them mingle and you've watched them, make friends and all that stuff, what's something you've noticed that's like, that's key to their success? They should keep that.
Oh, huh. Okay. That's a hard one too, but I think I can answer this one. I would say just feeling comfortable with them. Just being able to be on their level, or to be able to have something in common. Um, Devin's got a good friend. That's fine, Dominic. Um, Devin's got a friend that I feel like they're a lot on the same level, like they're, that they can really understand each other. And basically they like video games. They play video games together. They hang out and, check stuff out that interests them together. And I think video games is really what kind of is the connection between them. But I think just kind of their mentality, both also just kind of. I'm not really sure if I don't think his friend is autistic, but I think he has another ability that he struggles with. So I think that's where they connect.
That makes sense.
With Jade, yeah. With Jade, she makes friends pretty easily. Now I've noticed that although she makes friends pretty easily, she doesn't always have friends that come over to the house. They usually, a lot of them just go and hang out at cheer. They go hang out, or birthday parties or whatever. Usually she's invited to birthday parties quite a bit. And so, yeah. So all I can say is that they feel comfortable and can connect with somebody.
That's interesting, because that sometimes doesn't happen with autistic people, where they're able to make connections and so spontaneously succeed even with certain people. So that's actually fantastic to hear. Moving on, what is your biggest hope for their future, and what's your biggest fear?
Okay. Can I start with my biggest fear and then say what my biggest hope is? Even
Sure
though it
thing.
seems like you should really say what the biggest hope is, I guess the reason I want to start with my biggest fear is because it's kind of presented itself a little bit.
Oh, okay.
For Devin, he's 15 and he's going to be 16 in 2 months. And thinking about him driving, we've talked about it. I let him observe me when I'm driving and everything. And, but I think we have decided together, along with his stepdad, that we're going to wait a year, half a year to a year, and see where he's at to get him, driving or in driver's ed or whatever. My biggest fear. Yeah. So I'm handling that well, I feel like, but then in the back of my mind, I'm like, is he going to be able to be on the level to drive? Because with Jade, because of the seizures, I don't know if she will be able to drive. So it's kind of scary thinking about that.
Yeah. So have you looked into like post-graduation transportation options, such as maybe moving into a place that offers good public transport for them, or anything like that?
I haven't looked into that. It really isn't yet, and we're doing just fine where we're at now. Chris and I both drive. Chris is my husband, and so Devin and Jade's stepdad.
Okay.
And he wasn't quite really supportive at first, but he's been a lot more supportive and has done a lot for them. So, to a point, that's all they know is their dad at the moment. So, yeah. Anyway, so the second part of that, how did you word that? What am
your biggest hope? What's your
My
biggest
biggest,
hope for
okay.
their future?
My biggest hope for their future is that neurofeedback helps this thing, neurofeedback that we're doing, for both of them, will help them to get on the level to where they can be more successful living in society, and therefore getting, to getting past the obstacles that prevent them from moving forward.
And on that subject, without,
Mm-hmm.
you don't have to go into detail about this if you don't want to, but have you seen anything that kind of gives evidence to that hope coming true with neurofeedback so far, or gives potential?
I see it with Jade, just because she's presented so many, moving past the barriers that she's had. Devin, I'm definitely seeing improvements, small, minuscule improvements, and they're on this trial thing that, for neurofeedback. So they've been doing a couple, they call them cues. So I think Devin's on his second or third cue, and Jade's on her fourth. So they're almost done with this study, basically. Mm-hmm.
Very interesting. And when you say trials, is this like one of those free run trials where you're not spending too much money, or what are you meaning by trials when you say trials?
No, it's basically like where I don't know if I want to use the word guinea pig. That may be the wrong word, but they are subjects for a study for this specific type of neurofeedback. Very specific. And so they've been doing that.
Oh, so is this like a brand new type, or is that why it's so experimental, or?
It could be a little bit brand new, or newer. I can't really say on that. I'm not sure. It's just a research type thing that they're doing,
that would be very interesting to look up.
Try to help with things.
I'll have to look that up after we're done here. So anyway, moving on. If every parent in the world, that is every single parent or, person raising a kid in the world, was watching this video right now and they had an autistic kid, what's one thing you would want everyone to know about raising a child on the autism spectrum, or in your case too, that you haven't already mentioned?
I really want to stress this. I think the biggest thing that I want to say, that you should really try to do is be patient. You got to be patient. You've got to be understanding. You got to try to get on the level that they are as best as you can, even when it's frustrating, even when you want to pull your hair out and just say, this is just too hard. You just want to be able to, and you want to make them feel comfortable. I struggle with that. I can honestly say I do struggle with it. I'm doing better. I'm doing a lot better. But these are some key factors that you really need to try to do to make your life better as an autistic parent. Is you need to be patient. You need to be on their level, and you need to understand. The understanding.
And to go along those lines, would you say that having a big support net of family, professionals, friends, etc., has helped you in learning how to be patient with your own kids, or?
Oh, absolutely. Yeah. We are very fortunate that we do have people that have pretty much just different people that have shown themselves to be very instrumental in my kids' growth. Very instrumental in their growth.
All right.
Yeah,
Oh, go ahead. Sorry.
that's all I had for
Oh,
that one.
excellent. Well, to every autistic parent in the world, I get it. Sometimes, especially if you're doing it by yourself, it can be very overwhelming. It can be very frustrating. And as the son of a non-autistic man, I can assure you I have caused plenty of meltdown with my old man and my stepmom too. So you are not alone if you've had that happen.
Interesting you say that. I actually have some characteristics myself as an autistic parent of possible autism. So yeah, so mine's a little bit different that way.
Yeah,
Now
that's
my husband, not at all. He's yeah, he definitely he struggles in different ways that way.
although tell you the truth, sometimes I wonder if I'm not trying to dismiss the legitimacy of a potential diagnosis on your part or anything like that, but
Right, right.
I wonder if sometimes when a parent adopts characteristics of autism, it's because they've been around their kids so long that they've kind of absorbed some of that behaviorism into their mentality as well.
But wouldn't that
Kind of
be
like a social,
interesting to
yeah, kind of like a
see,
social osmosis.
figure out? Yeah. What if?
'Cause, yeah,
Maybe.
it's possible. It's happened
Yeah.
before, and oftentimes we hear more of social osmosis happening when, say, a U.S. citizen born in Mexico absorbs the Mexican culture or something like that, like my grandfather was,
Uh-huh.
or an Asian person who's born in the U.S. that absorbs the United States culture and all that kind of stuff. But we never really hear about the possibility of a parent, particularly one who's raised kids by themselves, absorbing aspects of their kids' mental pathology. So that would be an interesting study to do at some point.
Yeah, it would. Agree.
And with that noted, is there
Yeah.
anything else in conclusion that you would like to say that you haven't already mentioned and want to, or?
Um, yeah, I can add to this a little bit, if that's okay.
Sure.
Even though you asked me to do that. Okay, so I would say that, you know, having an autistic child or even two autistic children, as I do, um, again, like I said, they teach me so much. Um, they teach me about myself. They teach me about them. They teach me, about things that I don't even think about. Um, but then, like I said, there's the other part of that, the frustration. So, now what I've been doing when I get frustrated is I really I breathe and I just, maybe go out, maybe go for a drive, come back and, just like anything really, you get upset at something or somebody or whatever, you go for a drive.
Yeah,
Um, or head out for a minute and then come back with a fresh head.
that makes sense.
Fresh
I
mind.
mean, I personally feel like any parent should do that, if they can.
Yeah.
And
Yeah.
to kind of add on to that, as you may or may not
Mhm.
know, I am a part-time caregiver for the elderly and physically disabled now myself. And when I told my Tai Chi instructor what I was doing, she suggested something that I would like to pass on to you, and maybe you can consider
Okay.
this, is when you've got a moment and you have a couple of minutes or so to do it, take your hands, take and put on
Uh-huh.
cold water in a sink, and then run your hands through cold water for a little bit. And you just,
Mhm.
no soap, no anything, just run your hands through cold water. and see if that helps you. And the reason she told me about this was because, and this is kind of why I was interested in why parents adopt autistic traits, by the way, is
Mm-hmm.
being a caregiver herself. She actually told me that if one's not careful, caregivers have often tended to adopt elements of their clients' disease or mental pathology or something like that the longer they're with them. And so that's on an energetic level, that's when your life force is being siphoned out of you, and
Yeah,
you
that's
need to get
interesting.
away from whatever is causing that siphoning of the life force and chi and things like that.
Right. Okay. Yeah, that makes sense. That's interesting.
So yeah, so just a little extra tip that you can try out if you can, if and or if nothing else works, which I hope never happens.
Yeah. Yeah.
All right.
Cool. Yeah,
Anything
for
else?
sure.
Anything anything else you would like to say at this time, or?
I I can't think of anything else myself. Do you have anything for me? Anything more for me?
Well, just to say thank you very much for joining the Discussion Corner video series.
Sure.
Hopefully this will turn out somewhat good, but you know, if all else fails, it'll look like Stephen Colbert's current late show, at the very worst.
I think it'll turn out good. I think we've started a pretty
All
good
right. Well,
conversation about a very important issue.
oh yes. You know, this is a question I have that was not on the
Uh-huh.
list that I think should be added. So, in regards to everything that's gone on with COVID-19, what's
Uh-huh.
amazed you about your kids the most? And we're talking quarantine, we're talking reopening, all of that. In regards to all of that, what has amazed you about them and has made you proud about them?
That's that's a cool question. Yeah, they both have actually amazed me in the ways that they have been handling things. Um, you know, during COVID and all the uncertainty and things in the world. Um, Devin's been really interested in it. He's been wanting to know more. He's been wanting to, know real facts, make sure they're real facts, not just go on what he feels they are, just really interested.
So,
Jade, yeah.
so sorry to cut you off again, but does that mean
Oh,
like he's
okay.
trying to learn the facts of how the virus works, and the symptoms and all that kind of stuff? Is that what you mean by him learning more about
Um,
COVID?
yeah, yeah. He's so concerned with the whole idea that he just he's wanting to know all the new news and the media stuff and everything. Thanks, son. Um, all the uh, anything that he can learn on it, really.
That's a fascinating adaptive response to such a novel situation. And frankly, I actually wish
Yeah.
more people, autistic or not, had that mindset
Hmm.
of, okay, what can I learn about this?
Right.
So before I cut
Yeah.
you off, unfortunately, on accident, you were going to say something about how your daughters responded?
Jade, yes. So Jade, I feel that she has responded differently in a different manner. Hers has really been that she just has wanted to, you know, to live, you know. Um, she's also dealt with some, tragic events, as you know, and Devin and Jade both. And I feel like at a very young age, losing people is really hard, and we've lost two very important, um, instrumental people in our lives just recently, even before the COVID. Um, and so it's just amazing to me that Jade has just wanted to live. She just wants to live as much as possible and live in a fun way. And she's just, she brings excitement and she brings personality and her, characteristics. of just being a happy person amidst everything.
That
Um,
is
so,
that is such an incredible, amazing response.
yeah. Thanks.
Man, a combination of their responses in like the general populace, might
Mhm.
be what helps us get through this. And, I really hope people
Yeah.
do learn how to be either or both of those ways. So, I
Right.
can tell you right now that as someone who's known your kids for a while, who's worked with them in different capacities, I am,
Mhm.
I myself am definitely very proud to hear that they have had that response to COVID-19 and everything to do with it. It
Right.
just goes to show that adversity can be overcome. You just gotta kick yourself in the pants and move
Mhm.
forward as best you can.
Right. I would have to agree, Christopher. Definitely.
All right.
Yeah.
Thank you very much for joining us on the Discussion Corner video series. We hope to see you
Thank
again,
you
and we
for
hope
having
that,
me.
yep, it's an
Yeah.
honor, and we hope that you and your kids do very well for a very long time.
Thank you, Christopher.
Of
Appreciate it.
course. Of course. And I look forward to seeing them when the school year starts and all services are picked up again and whatnot as well.
All right. Sounds good.
Hi, I'm Christopher Cleveland, creator, host, and director of Autism Fridays with Christopher Cleveland. I am a certified secondary education provider located in Moab, Utah, and I'm here to tell you about my show, Autism Fridays with Christopher Cleveland. If you wish to have optimistic, educational, humorous, fun content which holds ideas for age-appropriate discussions for your autistic child or other relative about the COVID-19 crisis and your state's related efforts to curb its spread, subscribe to my YouTube channel or join the Facebook group Autism Fridays with Christopher Cleveland today.